A very good morning to everyone. This morning, I'm very pleased to introduce my colleague at the Medical Education Research and Development Unit, Associate Prof. Foong, Dr. Foong Choong. Dr. Foong has been with us since 2012, and he was actually involved in the implementation of the UMMP. He was very instrumental in actually helping us with the personal and professional development side of the program. This morning, he's going to talk to us and tell us how to teach the unteachable, the mindsets of medical students. So a synopsis of the talk is, we know that in medical education currently, we try to actually have the 4 themes, which is patient, doctor, basic clinical sciences, personal and professional development, as well as population medicine. However, we understand that medical teachers cannot teach every skill. As we've actually heard this morning from Dr. Choong, she has actually shown how other activities also aid in teaching the hidden curriculum that we try to impart to medical students. So this morning, Dr. Foong is actually going to talk to us to explain the fixed and growth mindsets in medical students, because he's been working a lot with medical students in terms of the evaluations that we do here in Merdu. So without further ado, can I invite Dr. Foong to present his talk?
Thank you, Prof. Jamuna. Good morning, everyone. First of all, thanks to YCOM for giving me this opportunity to share the topic with you, teaching the unteachable mindsets in medical students. Mindsets can be defined in many ways, but they all share one common theme. They influence how we think, feel, and act. Some people describe mindset as belief, the idea we hold about ourselves and the world around us. Others call them attitude, the habits of thinking and feeling that guide how we approach situations and interact with others. They also can be thought of as philosophies, the principles that shape our decisions and behavior. In simple terms, mindsets are like mental models or assumptions. They influence our thoughts, feelings, and actions in the ways we might not always realize. For example, imagine a student struggling with a difficult procedure in medical training. Their mindsets, whether they see this as a challenge, a problem, or an opportunity to learn, can shape how they respond. Understanding our mindset is a key to fostering growth in ourselves and our students. Now, let's keep it simple. What are mindsets? Mindset help us to answer the question, why do we do what we do? The logic behind this is simple. When we want to understand the outcomes we see, we start by asking, what did we get? That's the outcome. Next, we ask, why did we get this result? The answer lies in what we did, our actions and behavior. But if we go one step further, we find the root cause in why we acted that way. That's where mindset comes in. Mindset shape how we think, feel, and make decisions. These in turn influence our actions, and those actions create the outcomes we experience. So if we want to change outcomes for ourselves or our students, we need to start by examining and shaping the mindset at the core. Let's take a closer look at mindset on intelligence. This is an important aspect on how we view our potential to grow, learn, and succeed. Understanding this mindset will help us connect the dots between the belief and actions in our journey towards fostering success. To explore this further, I'd like to invite you to participate in a short activity. All right. I invite you to participate in a short questionnaire about mindsets on intelligence. Mindsets on intelligence. Remember, this is a safe space for reflection. There are no right or wrong answers. Your responses will help you to understand different perspectives on intelligence, which we will discuss shortly, and how it works. You will see a series of statements. You will soon see a series of statements. Please indicate how much you agree or disagree with each one using a scale from 1 to 6. Let's begin. Okay, let's begin. Okay, now I invite you to take a moment to reflect on each statement and answer quietly in your mind. There's no need to share your answers aloud. That's just for you. Here are the statements. You have a certain amount of intelligence or ability, and you can't really do much to change it. Your intelligence or ability is something about you that you can't change very much. Third, to be honest, you can't really change how intelligent or skilled you are. Fourth, you can learn new things, but you can't really change your basic intelligence or ability. Okay, fifth, no matter who you are, you can significantly change your intelligence ability level. Sixth, you can always substantially change how intelligent or skilled you are. 7, no matter how much intelligence or ability you have, you can always change it quite a bit. And last, the 8 items, you can change even your basic intelligence or ability level considerably. Right. Thank you for taking part in this question A. We'll revisit your answers shortly. Now let's move on. Okay. Dr. Carol Dweck, a renowned educational psychology, introduced the concepts of 2 mindsets that significantly shape how we learn and grow. These mindsets profoundly influence how we approach learning, feedback, and even failure. Let's talk about the fixed mindsets. This mindset is rooted in the belief that abilities are innate and unchangeable. Individuals with a fixed mindset often prioritize performance over learning, choosing tasks they know that they can excel in, and to gain approval or avoid failure. They might avoid challenges altogether, and when faced with difficulties, they respond with helplessness or take shortcuts to protect their self-image. Feedback is often viewed as a personal attack rather than an opportunity to grow. Effort in their eyes seems pointless since they believe their potential is always predetermined. This mindset can also lead to feelings of threat or jealousy when others succeed. As they see success as a limited resources, it creates a focus on negativity. Now let's explore the growth mindset. This mindset is grounded in the belief that ability can develop through efforts, effective strategies, and support. Students with a growth mindset focus on learning rather than simply performing well. They view challenges as opportunity to build their skills and persist through setbacks, understanding that the process of improvement matters as much as the outcome. They embrace feedback, seeing it as essential for growth, and celebrate the success of others, using it as inspiration rather than a source of comparisons. This mindset fosters resilience, continuous improvement, and a positive approach to learning. Interpreting the literature, let's consider how a fixed mindset manifests in medical training. For example, imagine a student completing their first venipuncture. If the procedure doesn't go as planned, a fixed mindset might lead them to think, I'm terrible as a venipuncture, and avoid volunteering for similar cases in the future. They may fear making another mistake, connecting their self-worth to that single outcome. This mindset can create tensions within clinical teams. Consider students who hesitate to ask for help with a challenging patient case. They might think, if I ask for assistance, my peers will think I'm not competent. Right. This fear not only isolates the students, but also denies them the chance to learn from their colleagues' expertise. Finally, a fixed mindset may lead students to focus on superficial achievement, such as aiming for high grades without truly engaging in the learning process. By contrast, a growth mindset can transform how medical students approach challenges and learning opportunity. Imagine a student preparing for their competency exam in clinical skill. They attempt a venipuncture, but the result isn't ideal. Students with a growth mindset reflect what went wrong. How can I improve? They see feedback from their instructor and apply what they have learned in the subsequent attempt. This iterative process builds both skills and confidence in the clinic's setbacks are possible. Consider a scenario where a patient history is incomplete during a case presentation. A growth-minded student might say, this didn't work, but I can learn from this. Let's discuss how I can improve. They actively involve their supervisor and peers in the learning process, transforming the mistake into a valuable experience. This mindset also fosters teamwork. Imagine a clinical team reviewing a case where a treatment plan failed. Instead of placing blame, a growth-minded group analyze what went wrong and brainstorm solutions for the future. This approach not only enhances individual learning, but also strengthens the team's ability to deliver better patient care. Ultimately, transitioning to a growth mindset helps medical students see challenges and mistakes as essential parts of their professional journey. It equips them with resilience and adaptability, which are critical for succeeding in both education and practice. Now let's look at the short questionnaire again. Your answer provides valuable insight into how we view intelligence and ability, and let's interpret the response together. Items 1, 2, 3, and 4 reflect a more fixed mindset. If you agree strongly with this statement, you might believe that intelligence is largely unchangeable, a trait that we were born with. In contrast, item 5, 6, 7, and 8 indicate a growth mindset. Agreeing with this item suggesting a belief that intelligence can grow with effort, learning, and persistence. Take a moment to reflect your response. What do they tell you about your own mindsets and how you approach learning? To recap, when we want to understand the outcomes we see, we start by asking what did we get? That's the outcomes. Next, we ask why did we get these results? The answer lies in what we did, our actions and behavior. But if we go one step further, we find the root cause in why we acted that way. That's where mindsets come in. Let's take a closer look at low-performing students and what might be holding them back. Often, their poor academic performance isn't random. It's a result of specific actions. For example, they avoid showing weaknesses and don't ask for help, even when they struggle to understand lecture content. Why? Because they see asking for support as a sign of weakness. To break this change, we need to address the root cause, their mindsets. The actions and behavior are just symptoms of deeper belief and attitude. If we want meaningful change, we need to help students recognize their limitations and embrace growth. They must change how they see themselves, their ability, and the importance of seeking help. When students stop fearing vulnerability and see value of support, they will engage more actively, ask questions, and clarify their understanding. This eventually shift to better learning, improve confidence, and greater academic success. The key is clear, change the mindset and the outcomes will follow. By correcting their mindsets, we can help students rewrite their academic journey. It's possible to help our students shift from a fixed mindset to a growth mindset. And let's explore some strategies. What are the small steps that we can do to foster this shift in our teachings and supervisions? As educators, one of the most impactful things we can do is to share our own story of failure and how we grow from them. This story reminds our students that setbacks and mistakes are not only natural, but also essential parts of learning and growth. For example, when you told students, I really remember struggling with inserting a urinary catheter during my medical training. It was frustrating, and I started doubting whether I could master these skills. But each failed attempt taught me something new. By seeking feedback, practicing consistently, and embracing the the challenges, I eventually developed the confidence and the skills. When we share such experience, we break down the pressure to always be perfect in medical training. Instead of fearing mistakes, students start seeing them as opportunity for growth. Encouraging open discussions about challenges helps students understand that success is not about avoiding obstacles, but about facing them head on and learning through the process. How have your own experience shaped the ways you guide students? When we as their supervisor or lecturers openly share our struggle and how we overcame them, it sends a powerful message. Growth is possible for everyone, and challenges are not roadblocks but stepping stones. Assessment play an important role in influencing how students approach their learning. However, a study in medical training showed that the current focus on high-stakes assessment often reinforces a fixed mindset. Taking medical training as example, exams and clinical grades dominate assessment, especially during the clerkship years. This emphasizes push students to focus more on achieving top score than on personal growth or skill development. Imagine a student preparing for a high-stake exams. Their main concern become passing or achieving an excellent grade, leaving little time to reflect or improve their weaknesses. Additionally, a survey on medical school in the US and Canada found that while pass-fail grading is common during pre-clinical years, traditional grading still prevails during clinical training. This shift adds pressure for students to perform perfectly. Graduates medical training has adopted milestone-based assessment, which aims to emphasize progressive growth. However, residents often describe the feedback they receive as unclear or overly critical, focusing on isolated performance instead of their overall performance. This system creates an environment where students and residents may hide their struggle or avoid asking questions out of the fear being judged. This is not only stifle their growth, but also make it challenging for supervisors to identify areas they need help. And so, how do we adjust our assessment system to prioritize growth? To foster a growth mindset, we need to reimagine how we assess students and residents, shifting from a focus on grades and isolated performance to a system that promotes continuous learning and improvement. The way we design assessment can significantly impact whether students develop a fixed or growth mindset. Currently, assessment that's focused solely on the results often leaves students feeling that their abilities are fixed and unchangeable. Imagine a student repeatedly struggling with inserting a nasogastric tube during clinical skill assessment. If the feedback they receive is solely a grade pass or fail, they might begin to believe they are inherently poor at the skill. But what if the focus shifts? What if we assess how students handle challenges, how they adapt and grow from their experience? This would encourage a mindset where improvement is always possible. And to do this, providing frequent, meaningful feedback untied to grades is a powerful tool. For instance, instead of saying you failed to meet the competency, we could say you are not yet competent. Here's how we can work together to improve. Non-graded Formative assessment, such as mock clinical exams or reflective assignment, create safe spaces for students to focus on their development without the fear of judgment. The language that we use matters deeply. Phrases like not yet competent signal that improvement is possible, inspiring students to see their potentials and keep trying. To make this shift work, we as educators must embrace the idea that struggles and growth are natural, essential parts of learning, not seen as failure. This mindset change begins with us and how we approach assessment. As educators, we understand that it's impossible to teach students every single skills or piece of knowledge they will need to for the unknown challenges of future medical practice. The field of medicine is constantly evolving with advancements in technology, treatments, and patients' expectations emerging all the time, preparing students for every possible scenario that's simply not realistic. How might we better prepare our students for the unpredictable future? We can instill growth mindset that empowers students to adapt, to learn, and to thrive in the face of uncertainty. Considering the situation now, the rise of artificial intelligence in the diagnostic or the integrations of telemedicine in patient care, a student that was only trained in the traditional clinical setting might struggle to adapt, but a student with a growth mindset would view these innovations as opportunity to expand the skill set and embrace new ways of delivering healthcare. In the end, it's not about knowing everything. It's about being ready and willing to learn continuously throughout their career. This is the foundations we need to build in our students so that they confidently navigate the complexity of medical practice with resilience and adaptability. Yeah, okay. So in closing, I'm deeply grateful to have shared my thoughts with you. Okay, thank you.
Okay, thank you very much, Prof. Foong, for this enlightening talk. Are there any questions or comments? So in medical education, we find that it's just not changing the mindsets of students, but also the mindset of teachers. Teachers were trained in an era where it was a pass-fail exam, but we are now in an era where we look at competency-based assessments. And therefore, I think this mind shift needs to occur not just with the teachers, but also with, the students, but also with the teachers. This morning we actually saw how primary care with its Hebat project has actually conducted the CEOPC, which is community-based primary care, but very much student-directed. And I think the current generation are very keen to have it student-directed kind of learning rather than teacher-led teaching. So therefore, we need to also try and educate or retrain the teachers to think of allowing implementation of the program to be more student-led. And that is totally a process that needs to be imparted to our academic staff. I must say that in many cases, I have been able to see that the faculty is now moving towards that direction. But I think we need to consider more of this kind of teaching learning experiences for students so that, the mindset is willing to accept new ways of learning. So if there are no further questions, thank you, Prof. Sarah. Yes. they have to be more independent. I totally agree with you. But I think sometimes because of the structure of the program and the way we impart, we try to, pull them back, and we need to make those changes. And I welcome everyone who's out there who has got good ideas to come and share so that we can see whether we can actually, put this in place for student learning. Yeah. Will Murdu change student assessments? Meaning, can whoever that is actually elaborate on what do you mean by changing student assessments? Because we try to make it competency-based. I think there are a few questions in Q&A chat box. I am looking at the changing a pass versus fail. So as in the top rather than fail, call it, yes. So this is where the workplace-based assessments come in. And we are trying to introduce that initially to the postgraduate programs so that the trainers have and the students develop the maturity, and we can see how we can then put this in place for our younger students. So yes, we are looking into it. But this needs a lot of buy-in from faculty. I mean, we can't implement anything if faculty doesn't, actually buy into this whole thing. So yes, we are definitely looking into it, and it's already coming to that because we give remediation after end of posting. And say, okay, you're not ready yet, and these are the weaknesses that you have in your assessments. And we actually do that remediation part. But to actually assess them until they're competent is going to mean a lot of logistics and a lot of participation of teachers. So we have to weigh the pros and the cons as to how we actually change the assessments to more work.
Yeah, Prof. Jamuna, to add on, some of the UMB assessment are already a not yet pass rather than a fail assessment. For example, the mini CX, yeah, that's never a fail, but okay, not yet competence and reassess. So we are working to that direction actually.
Yeah, to introduce that, we need a lot of buy-in from the trainers and the academic staff, because it's a lot of work for them to assess. Yeah. That's our dream. Instead of having this, end of year exam that, is a do or die exam. So are there any other comments? Yes, with Prof. Sarah, we can say not yet passed, and we do that. Yeah, I see the mindset thing. We can look into it definitely, for sure. Thank you. Okay, if there's not any more comments or questions, thank you very much for attending this talk this morning. Thank you very much, Prof. Foong, for a very enlightening talk, and we will meet up again the next time. Thank you and goodbye.